We're gonna go over this video real quick. So right here we see McKenna is in, this is right stance phase. Let's back up a bit. This one's easier to see. So, sorry if I was better at this.
Dog.
Okay, that's a good one to see. So, she's drastically rotated inward right here. Maybe zoom in a little bit.
Yeah.
Hold that right there for me.
Look at the doggy. Look at the doggy.
Yeah, she's trying to get the ball. So right now she's in right stance phase of gait. That means her right leg is forward and touching the ground. So her pelvis on the right is internally rotated. Okay, she's swinging her right arm back to try to gain right rotation through her thoracic spine right here, but she never actually gets right rotation because she's so rotated to the left, she can't achieve right rotation, so she throws her arm back there to compensate for that. But in normal gait, things are reciprocal, so when you internally rotate on the right side, you should see internal rotation on the left side. So when we watch her take a left step forward, she does not get any significant rotation in like she does on the right hand side. So that's a perfect example. Watch her, this is left stance into right stance. You have a ton of rotation. Watch her shirt shift down to the right. She's got a ton of rotation right there versus when she goes to the left, not a ton of rotation. You're also seeing a big discrepancy in how she hits the floor. You see that how she collapses and lifts? That's because her left leg is functionally shorter than her right leg due to her sacral rotation, okay? So that's actually extremely common. She's just compensated further than the normal pattern. So she's got a functional leg length discrepancy due to sacral left rotation. She's also, her thoracic spine is rotated to the left. That's why when you see her walk, she's constantly trying to stabilize with this right arm. This right arm never gets to swing, okay, into left rotation here. So if we watch it in real time, you'll see that right arm is just kind of hanging out to dry, never comes around.
Hey, can you wipe the dog?
Okay. Does that make any sense?
Yeah.
I have to talk in certain terms in case you talk to the therapist, but
No, that
Can you
was
wipe
that was
the
great.
dog?
huh?
Well, could you explain the breathing, like the loop with her
Okay,
breathing?
so if we
and
watch,
everything?
let's watch it from the side here.
Can you wipe the dog?
Hold on, we're doing a video right now. We're gonna put it on YouTube. We're gonna make Patrick famous.
Yeah, right.
Patrick is not famous.
Oh, you okay?
No. Look. Can you wipe the Papa? Can you wipe the dog?
Actually, I'll do it on my way.
Okay, yeah, perfect.
You ready to take a picture of this?
Yeah, I did.
Okay, so, yeah.
Can you wipe the dog?
What do you mean?
The dog.
What about it?
Can you ride it?
Ride it?
Ride it.
You can try to ride her.
Yeah, you can have fun.
Okay, so you have a normal, this is a normal spine right here. This is her head, right? This is pelvis, shoulders, right? Arm. The diaphragm here, you have a right and left diaphragm, needs a rib cage to dome on, okay? Her rib cage, that's a terrible picture, but from the side view, what's happening is she is actually extended like this.
Yeah, she's like leaning forward and putting her butt out, which is preventing the oxygen from getting low in the rib cage.
She has extension of her pelvis through here. Damn, I wish I was an artist. That was probably the worst. Let me take my time and draw a decent drawing here. Okay. So here's her pelvis. Here's the top of her rib cage. Okay. Here's her leg.
You stay.
Here's her head. This is the rib cage. Alright, so she's dumped forward. So her back has a ton of tension. We already talked about that, right? So in a normal diaphragm, the pelvic floor is here, okay? And the diaphragm can dome up and down like a piston, right? To get gas exchange through the lungs. Now, more alveoli live at the bottom part of the lungs than the upper part, right? So when she takes a breath of air in, it's extremely difficult because of the position of her pelvis and the position of this rib cage, which is flared out, which you can see if you just lay her down on a bed and tell her to take a deep breath. She has to extend this further up this way to get air in, all right? Air never gets down to this bottom area here where all the alveoli live. So she needs to improve the position of her rib cage to allow for better expansion. So the only place that she can expand right here, because she's compressed all in her back through here, her back is stabilizing because the back is the only thing that keeps her upright when she walks and functions. So in order for her, with such compression back here, the only place she can expand air is in this front cavity right here. So she's constantly breathing with her accessory tissues up in the front right here for her to take a deep breath. That means air never gets into the lower part, and she's at a greater risk for things like asthma, COPD, and she's also in a state of hyperinflation.
Right.
So,
and just so I'm clear, like this was caused by her sacral rotation.
This is all caused by the fact that her sacrum. I can sit here and make a case for you that all this is caused by her breathing. I can make a case that this is all caused by her sacral rotation. It's very much chicken or the egg.
Right.
I don't know which one happened first, but something along with her development. Now, it could be neurological, where we're dealing with, when we're talking about eyes and reference. So we don't know. I can't give you an exact area, but I know that, for example, like if we attack the sacral rotation and we don't treat the breathing will continue to pull her out.
Right.
Yeah. And so you need a treatment
You fix it
that
all together.
you need to fix everything together. You need to bring less tone to the back, less compression, so that she can gain leverage and her abdominals and her core can get stronger, right? The hypermobility or instability is something that you're just going to battle with, especially at her age. It's not something you're going to really be able to address. Any female at her age is going to have some hypermobility.
Makennas,
Can I watch YouTube on the iPad?
On the iPad you can. The sacral rotation is mostly treated through manual therapy, and then the breathing exercises. We have a device that trains the respiratory system. So you definitely need a combination of positive neurological references. One, like a neurological reference.
What's the passcode?
Would be like an orthotic. Alright? And then two, you need manual therapy
Makennas, hold on.
to deal with.
Don't watch that right now. Play with the dog, okay? We're almost done.
What's the passcode?
Baby,
It's
that's
all-
his iPad. You don't want to go all in there. You'll.
Here.
Is this 8?
Yeah. It's real simple.
I need to watch the video.
So you're going to need some kind of manual therapy to deal with the sacral rotation, but then you are going to need to help hold that position because of the instability. You do need strength.
Okay.
So there needs to be like an exercise component. Now, the exercise component simply could be her doing gymnastics and moving around more.
Right.
You know?
Right. Yeah.
So I know this seems complicated, but honestly, with her age, it's difficult
Yeah,
because
girls.